Hello, everyone. Welcome to episode 8 of BAMEOTUK UK podcast channel on YouTube. This episode is Let's Talk Promoting Occupational Therapy as a Career Option to Our Bangladeshi Communities. Today, really excited, I have an across countries panel. We have representing UK and USA on the panel today, and I'm going to ask them to introduce themselves now. So I'm going to start with Myrna. Welcome, Myrna. Could you introduce yourself?
Yes, thank you for having me. My name is Myrna, and I'm a student in the US. I finished my Bachelor's of Science in Public Health, and I immediately entered into OT school. So I'm completing my Master's of OT, and I'm a first-year student. So I'm finishing up my first year here in Philadelphia at Temple University.
Thank you, Myrna. Welcome. Mokter, would you like to go next?
Hi, yes, thanks for giving me the opportunities to get into this podcast. And I am Mokter. I am the occupational therapist working since 2004 in Bangladesh and came to UK and started practicing in the UK. Currently, I'm working in East London NHS Foundation Trust as a senior occupational therapist. That's it.
Thank you, Mokter. Welcome, welcome. Bijan, would you like to go next?
Hello, this is Bijan Saha. So I'm currently working as a clinical occupational therapist and a team lead in East London NHS Foundation Trust. And I'm working here since 2015. Yeah.
Welcome, Bijan, and Yeasir.
Thank you for today. So I am Yeasir. Currently, I am working in University of Illinois, Chicago as a research associate. And I'm here in US only for 3 months, so just new. And in prior, I work in Tokyo Metropolitan University, and I completed my PhD from Tokyo Metropolitan University. And I moved to Tokyo from Bangladesh. There I work in Bangladesh Health Profession Institute as a lecturer of occupational therapy. Thank you. Thank you, everyone.
Welcome, Yeasir. I'm so excited because where I live, there is not much of a Bangladeshi community. Usually I'm the only one. So I'm really glad to be on this podcast with my brothers and sisters. I better introduce myself because I've been told that in one of the podcasts I didn't say who I am. So my name is Mish Ahmed Landayu. I'm a lecturer in occupational therapy. I also see myself as an occupational therapy activist. I'm a member and co-founder of BAME UK, and we're an activist and campaigning group. Before we get sort of into our questions, I thought I'd give a little bit of background and introduction regarding Bangladesh and the community here in the UK. Bangladesh is called the People's Republic of Bangladesh. It is a country in South Asia. It gained its independence in 1971. Bangladesh shares land borders with India to the west, north, and east, and Myanmar at the southeast border, and the Bay of Bengal is in the south. It is a large Muslim population, making it the third largest Muslim country. And there are many religious groups that coexist harmoniously in Bangladesh. And I always like to say this, that the national animal of the country is the tiger, and the conservationists are working hard to keep this animal from becoming extinct. And the national flower is the water lily, a lovely, beautiful flower. And also, I guess politically, Bangladesh is helping the world by taking in the Rohingya refugees that are fleeing from the violence in Myanmar. Regards to the UK, there was a large migration to Britain during the 1970s, leading to the establishment of the British Bangladeshi community. The Bangladeshis were encouraged to move to Britain during that decade because of the war for liberation from Pakistan, and due to the natural disasters from the cyclones, and really there was a lot of instability in the country and the desire for some of the population to escape poverty. Most of the population that came and settled in the UK were from the Sylheti region of Bangladesh. It was not easy settling in during the 1970s and 80s, as we experienced institutionalized racism and racial attacks by organized far-right groups. But Bangladeshis, we are a peaceful, strong, and resilient population and have established deep roots in the UK. And yet people from this population set up the initial modern curry houses or restaurants in the UK. Most of the Indian curry restaurants are still run by people from the Bangladeshi population in the UK. But an interesting thing I found out was that a Nawab called Sheikh Deen Muhammad, a trainee medical surgeon in the East India Company in the 18th century, did set up a Hindustani dinner and hookah smoking club where you could get a nice curry meal. So I don't know if our US brother and sister wants to add anything about the Bangladeshi community.
So the US has a smaller population of Bangladeshi people. From my last research, I know that there's approximately around 200,000 Bangladeshi people living in the US. There are certain areas that are more concentrated, like New York, New Jersey, Philadelphia, DC, some areas of Florida, California, and I guess around like 70% of Bangladeshi people are actually in New York. So New York is very, very concentrated. There's a lot of Bangladeshi businesses. Again, like you mentioned, like the restaurant businesses, very, very popular. There's certain areas that you could walk and it'll look like it's like Bangladesh over there, especially in New York and New Jersey. So those are very, very concentrated areas. You definitely meet a lot of people that you run into. Everybody knows everybody kind of situation over here in those areas.
So in Chicago, it's very united, especially South Asian region. So we call it Devon. So Devon is the area where all of the South. So it's not like Bangladesh, but it's in a way South Asian. So Pakistani, Indian, and Bangladeshi all together. And yeah, I found that one of the glossary stories named Sundarban. So even it's written here in Bengali language. So I feel proud to be a Bangladeshi.
Oh, thank you for informing us about that, because I didn't know any of that. So that was really good to know about and add to the podcast information. That's really good. Shall I start with my first question? Let's see how we go. And I'm going to say that as part of my first question, someone has to say this in Bangla as well. How would you explain the profession of occupational therapy to a lay person? Shall I start with Yeasir?
Oh, thank you. Occupational therapy, still now we don't have any Bengali name. You know, lots of countries they translated occupational therapy in their language, but still now in our country we keep it unique. So it's occupational therapy. Everyone call it occupational therapy. And এটা হচ্ছে একটা স্বাস্থ্য সেবামূলক পেশা, যেটা একটা মানুষকে দৈনন্দিন জীবনে স্বাবলম্বী করে, এবং আমরা একজন মানুষের শারীরিক এবং মানসিক যে সমস্যাগুলো আছে সেই সমস্যাগুলো হচ্ছে আমরা অ্যাসেসমেন্ট নির্ণয় করার মাধ্যমে এবং চিকিৎসা পদ্ধতির মাধ্যমে একজন মানুষকে স্বাবলম্বী করে থাকি। That is my only few words in Bengali.
Loving it, loving it. Thank you, thank you. Bijan, do you want to say what is occupational therapy in English, and if you want, in Bangla?
Yeah, thank you. So if I want to explain what is occupational therapy, I would say occupational therapy is a independent healthcare professionals that is offer very specific patient-centered or client-centered practice where we can assess their independence, how they are getting with the day-to-day life. For example, if I say how you are getting on, how do you are walking around, how you are doing your day-to-day job, for example, washing, dressing, eating, everything. So what occupational do, so they do the assessment, yeah? So they do the assessment of the different areas, occupational performance component, for example, sensory, motor, cognition, psychosocial, and the perceptual as well, yeah? So based on their assessment, they find out the problems the individual have. So following the problem they identified, they create a treatment plan, and definitely we set the goal with the individual person, what they like to be achieved and what they want to see after having occupational therapy session, isn't it? So that is the both way working between the individual plus therapist, and then we can together make a plan that is realistic plan what we can achieve through this through the occupational therapy input. So the occupational therapist treatment provide the different way. So we can provide the exercises program, education program, and practice day-to-day life practice, and that's why they can develop their daily living skills that make them independent according to their abilities. That's it really from my point of view.
Myrna, as our student representative, how would you explain occupational therapy?
So here in OT school, they tell us, what would you say to someone? What's your elevator pitch? What is something that you can say really quickly to somebody that they will get a general idea of OT? So we're trained to like have something ready when someone asks us, very briefly. So for me, I say occupational therapy helps people to have a greater quality of life that is functional and meaningful to them. So occupational therapy practitioners help people be able to do the things that are necessary and important in their daily lives. And I kind of just leave it at that, and people sort of understand, and they'll do their own research to kind of figure out what are the more detailed aspects, because it's really hard to get into detail in like 30 seconds about what it contains. But everyone else here did a really good job explaining, better than I did.
No, that's good. That's a great challenge, that kind of idea of an elevator pitch. I like that. Mokter.
I will try to say it both in Bengali and English. Okay. So in my understanding, I want to think occupational therapy in a different way, in a different perspective. So when anyone think about occupational therapy and health profession, then people think about, oh, it's someone who works just for health to get people independent. But for me, I think it's different. Occupational therapy always looks the understanding about life, the understanding about day-to-day activities, what we are doing through our day. It's not only for the disabled people, it can be for the people who are able, but differently able, okay? So occupational therapy can bring people together to understand what is underlying into our daily life. So how it works comparing to our physical, psychological, social, environmental, as well as the other perspectives of the life, to get us be focused on our life, to be able to be more capable to stay our life more independently, okay? So such as, I would say that if I think about it, children as who are born, the parents sometimes doesn't really understand what is happening to their lives, what's going, how the children are developing around their areas, okay? But as an occupational therapist, we can easily understand, focus on children's lives, then how, which way, what stage, at what developmental stage they are, and how this life can be promoted, can be developed following proper guidelines, okay? In one class, if one children, you will find they are comparatively academically better than other children. But why it is happening? What is the underlying issues happening over here? What, is there any psychological, social, and other environmental, any factors that happening? Both of them have got same sort of like intellectual abilities, but why one goes ahead and another one can't go ahead? An occupational therapist can do a comprehensive assessment on it and finding out what is happening, and then giving a proper solution, what to do. So my understanding is OT, occupational therapy, is something who can help people who needs help to be independent with their day-to-day activities, to be able to promote their life, to succeed their life. Okay, so in Bengali আমরা যা বুঝি occupational therapist হিসেবে সেটা হচ্ছে disabled people দের ট্রিটমেন্ট করা। বেসিক্যালি এটা না, disabled people দের ট্রিটমেন্ট না, এটা occupational therapy একটা holistic approach type treatment process where আমরা able এবং disabled both people কে assess করতে পারি, তাদের সারাউন্ডিং, সাইকোলজিক্যাল, সোশ্যাল, ফিজিক্যাল, all factors নিয়ে অ্যাসেসমেন্ট করতে পারি, করে আমরা খুঁজে বের করি কোথায় প্রবলেম আছে, একজন মানুষের ডেইলি লাইফ স্কিলস লিভ করার জন্য কোথায় প্রবলেম আছে। এটা হোক বাচ্চা, হোক অ্যাডাল্ট, হোক ওল্ডার পিপল, all types of people, all categories of people আমরা অ্যাসেস করতে পারি, আমরা প্রপার ট্রিটমেন্ট অ্যাপ্রোচ তৈরি করতে পারি, সেই ট্রিটমেন্ট প্ল্যান অনুযায়ী গাইডলাইন করতে পারি, আমরা কিভাবে একটা স্টেজ পার হওয়ার পরে আরেকটা স্টেজে গিয়ে কি করা যায়, কি করলে ভালো হয়, ওগুলো ফলো আপ করতে পারি, রিইভালুয়েট করতে পারি, রিঅ্যাসেস করতে পারি, রিসার্চ করতে পারি। আবার আমরা এটাকে একটা স্মুথ ওয়েতে যেভাবে চালানো যায় লাইফটা, সেই বিষয় নিয়ে চিন্তা করতে পারি এবং পসিবল সলিউশন আমরা বের করে নিয়ে আসতে পারি। এটা হলো আমার অকুপেশনাল থেরাপি সম্পর্কে বলা।
Thank you, Mokter. That was so helpful. I suppose I better have a go at this as well now. I feel like, I need to do this too. So, as an educator, what I say to students, and I challenge them a lot. Really, our therapy is, our tool in our therapy is activities. That's the modality of treatment that we use. That's the tool we use. That makes us very unique from other professions because it's that everyday tool that we use. And we are about just helping people through activity-based treatment tool to enable them to do what they need and want to do to get on with their everyday lives. That's it. That's what I start off with. And then obviously we get into the whole complexity of the human person and how they do what they do, why do they do it, what are the motivations and causations. So that's how I sort of start it off. It's about enabling people to do what they need and want to do to get on with their everyday lives, whether that be work, whether that be being a homemaker, whether that be getting on public transport, whether that be going and doing a leisure activity like swimming. We're there because that's about everyday living. And I'm going to try it in Bangla because I have to do it for my Abbaji because he said it to me. I might pronounce it terribly, so you'll have to correct me if I get it wrong. Here I go. Occupational therapy আপনার চিকিৎসার জন্যে ব্যবহার করি আপনার দৈনন্দিন জীবনের কাজ পুনর্বাসন জন্যে, যাতে আপনার জীবনের মান উন্নতি করতে আর সহ্য করতে যেমন আপনার জীবন চালিয়ে যেতে চান। Occupational therapist কাজ করে পেশেন্টের সাথে যাদের অসুখ যেমন ডিপ্রেশন, স্ট্রোক, পার্কিনসন ডিজিজ, সেরেব্রাল পলসি এবং আরো। Occupational therapist কাজ করে হাসপাতালে, কমিউনিটি ক্লিনিক, জিপি ক্লিনিক, কেয়ার হোম এবং আরো জায়গা। Yeah, so that is occupational therapy. And I think because we're all different, we've translated it and observed it, experienced it, understood it, and we'll deliver it in different ways, but we'll understand the core principles and practices and processes. So as this is about promoting occupational therapy as a career, my next question is, why would someone choose this career, especially from the Bangladeshi community, and what are the benefits or what do you like about this career? Shall we start with Bijan?
Yeah, thank you. So the why we choose the occupational therapist, if I consider myself, yeah, whenever I was in Bangladesh. So if you do the any fresh graduate from the university, it's really hard to find a job, honestly speaking, back home, isn't it? So that's why I thought I can choose the something different that will be easy to get the job once I finish the graduation. So that's why I chose the occupational therapy at that point. Whenever I studied back home, Bangladesh, it was comparatively new profession. And I know whenever I will finish the graduate, so I can get a job easily without any competition. That's really happened to me as well. So after finishing my graduate, straight away I worked with the CRP and then BASP, Bangladesh Health Professional Institute. So that is one of the reason I choose the for occupational therapy. And secondly, if someone want to work with human, so this is one of the noble profession I would say to work with. So you can consider the physical aspect on top of that, the mental aspect of it. It's the combination of physical and mental. I always say occupational therapy is like a combo. It's not like a physical or either mental. It's a combination of both. So if someone is really interested to working with the people, that could be the one of the potential subject you can go through. And other things I always consider as occupational therapist, there have a huge wider area to work with. For example, it's not limiting with the clinical areas. So you can work as a researcher, you can work as a clinician, you can work in the NGOs, you can work in schools, any settings. So you can use variety range of areas you like to. And and another things I liked, I want to encourage to join in the occupational therapy. The reason being, they consider as a holistic approach, not like a tunnel vision. Okay, you have the problem with this one, just solve this out. No. So you always consider it as a holistic approach so that individual can improve their abilities within their circumstances. So that is the possible reason I selected selected occupational therapy my profession. Thank you.
Wow, wow, that's really good. And yeah, what you said about also it's about the economics of it. Will you find a job? How competitive is it? Will I get a job? And then you researched and you found that occupational
Yes.
therapy could give you that advantage of finding a job. Yeah. Thank you. Yes, sir.
Thank you. So I choose occupational therapy as a profession. I would like to make it in two stages. So first, I choose it as a profession for undergraduates. So I'm totally agree with Bijan sir, because in country like Bangladesh, so we look for jobs after just completing our undergraduate course. So in that way, this is a course. So still now we have available job. No one is unemployed in our country for occupational therapist. And this is one aspect, and always the people who are studying occupational therapy from Bangladesh, we have a good reputation. The Bangladeshi occupational therapists who are working in abroad, in Australia, in UK, or in Canada. So this international immigration and practicing occupational therapy, we have a good trend. And that's why it makes people motivated to studying occupational therapy in Bangladesh. So not only working in locally, it also can help us to find job internationally. And then I again realized that I need to learn more, and then I choose post-graduation in occupational therapy. It's because I realized that occupational therapy, it's not only it's not only the clinical practices. So we can contribute to develop evidence and knowledge. And that's why I realized that it's not only our thinking under the medical model, how we can connect the social and human rights, all of this, the boundary together to framing occupational therapy. And then I choose this profession again at the postgraduate level. So, many people who had either undergraduate in OT, they choose public health or other discipline at the post-graduation level. And other people who has the undergraduate in different subjects, that choose OT at the postgraduate level. But I keep in same trend. And additionally, I would like to include during my studying and after completing my graduation, when I practice occupational therapy with my client, I realized that we help people across their lifespan. It's not a temporary relationship with our client. We think for their whole life, how they will be independent. And it's like a novelty in everyday practices. We have to think about the innovations. So sometimes it's not written in book. So we have to think. This innovative thinking comes from our mind. It's based on our culture. It's based on our practice, the phenomena that remain in our own country, in our own culture. And we not only raise hope to the people, we also take part in people hope. We stay with the people whom we work with. And this profession, after continuing this profession, I personally, as an occupational therapist, I thought that it gave me benefit in my personal life. So I know how to pursue my goals despite all of the odds. I can respect other people's beliefs, values, culture, and other people's lifestyle. It helped me to learn my uniqueness as a person, and I can share my uniqueness as a person. And I have an occupational perspective, and I use my lens that actually not only thinking very specifically at the micro level, I can connect micro, meso, and macro level together to think a person completely in their lifespan. Yeah, that's all.
Wow, yes, sir. I love that moment you said it also helped me understand myself and made me much more open and understanding and knowledgeable of other people. That is power. That is power. Thank you. Thank you. Myrna, over to you.
So for me, I kind of flip-flopped around a lot of healthcare professions. I always knew that I wanted to go into healthcare, not just in the Bangladeshi community, but in the US in general. OTs is still like very not well known. And we talk about this in school all the time, how nobody knows what OT is. Everybody assumes that you're a PT or you're a nurse or something like that. OT is still not a well-known profession, even here in the US. And I know in the Bangladeshi community, a lot of us in where I live, and probably maybe in Bangladesh as well, I have relatives there as well, speak to them. Many of us know healthcare through doctors, nurses, pharmacists. But there's all these other health professions. There's behavioral techs, radiologists, PTs, OTs, speech therapists. Like there's so much more beyond those other professions, which are all very, very necessary. Here we talk about interprofessional collaboration all the time in the US. There's an entire team that goes into your care. It's not just the doctor. It's not just the nurse. They all work together. All these professions have to come to work together for like one patient. So there's a lot of variety in healthcare. And for OT, for me, as a profession, gives me a sense of fulfillment that you're doing more for a person to make their lives easier. Again, like you're promoting independence and function. And what I like about it is that you get to learn about people in depth, and you get to use your skills as a healthcare practitioner to look beyond the medical charts, the medical diagnosis. This is what's wrong with you. You give people hope and chance to do all the things necessary to live their lives, especially quality of life is something that we really focus on as OTs. And I know that in our Bangladeshi community, it's very, very difficult for people to really understand like development, like Mokter was talking about child development. I have experience with relatives, their children, they do require occupational therapy services. They do require PT. They do require speech therapy, but to them, it's not, considered treatment because it's not something that's the norm. That's not something we normally typically seek out. You will normally go to a doctor. You will normally see a nurse at the ER. You will normally go to the pharmacy, speak to a pharmacist, get your flu shot. But do you see people commonly going and getting rehab services? Do you see people going outpatient to get treatment for a TBI or something, or they recovered from an accident or recovered from a stroke? Do people actually go? They're like, oh, no, this stuff doesn't work. And if anything works, possibly like the most well-known is probably PT. Even then, that's like, oh, they're just making you do a bunch of exercises like that that knowledge and that like experience, like when you see other people do something, you're more inclined to like go and approach that area. Like if I see someone, oh, they're getting OT services, PT services for their child, and I'm noticing something's wrong with my child, oh, let me go talk to that person, like, well, what are they doing with OT-PT? But we don't have that here. You don't see people do that. And people who are, from my experience, people who are suggested to get OT or PT or speech therapy, any kind of those services, they're like, oh, do those things really work? Because in the Bangladeshi community, also another thing is that they want immediate solution. They want the immediate, give me this pill, let me take this, it's me better. I have this pain, I'm going to take this pill, it's going to make me better. Give me this kind of cream, I'll apply it, it'll make me better. They just want the immediate solution. There's this concept of like things take time. There's a process to things, there's a method to things. They don't, and even like here for OT, you need a master's degree to practice OT, a master's and doctorate now. And sometimes people don't even think like, this is a profession that like requires such a high level of education. You would think that, there's a lot more to it than just doing some exercises, so that is not there. The understanding is not there. The representation is not there as well. So there's a lot we need to do as a community to promote this profession, and also make the community understand that, this is not just something, some exercises, something that doesn't work. It's an actual form of treatment. It works. There's evidence behind it. But I think there's a lot more work to be done to show people that, this is a form of healthcare and this exists for us. We have the resources and we should use it when we have the opportunity.
Go, Myrna, go, go, go. Yes. I don't think we do enough to get into our communities and promote occupational therapy as an option for a career for their children, and for adults who want to change in their career as well. And we need to get more forceful and create more presence in our own communities as well. We need to bring our communities with us, and how do we do that? And we need to be active about it and not just say it's not happening, they're not doing. If they're not doing, then we're not doing it right, are we? We're doing something wrong if they're not coming with us, And I think that's really important point to raise, man. It's a really important point to raise. Mokter, over to you.
Yes. Well, I mean, before I came to OT, I didn't know what is OT. Me, Bijan, and Yeasir, we all have graduated from the same institute. So when my uncle is a physiotherapist, and he was kind of like, I was ready to apply for a physiotherapy course to do my physiotherapy graduation. And then when I came to the university on an open day, there was a lot of volunteer who went over there in Bangladesh from UK. So as my uncle was senior than me, and he was known by everyone on that institute, and then he introduced me with a volunteer OT over there. She was a teacher over there on that time. And then in my mind, there was three things going on. One is I want to finish my course and get a job straight away. Second one is I want to practice internationally, and I also want to practice for myself. And third one is I want to do something which is I am really satisfied on. I don't really want to be unsatisfied and no, I don't want to do these things. So these are the three things in my mind before I kind of came into the course. And then when I talked to the teacher, I forgot her name. She was really lovely OTs in the UK, and she went to Bangladesh to teach students. She said that, okay, so if you want to get a job after you do the course, if you want to work internationally, I think OTs is the best profession for you. It's because the demand of OT is much higher than the physiotherapist. So the way she was saying that why the demand is high, because the profession is not known to everyone, but there is a lot of opportunities, lots of where an OTs can work in this world. So she told me that, oh, you can work with children in different fields. You can work with adults, even you can work with mental health, you can work with physical disability, you can work with mobility, work on wheelchair, pushchair, sittings, and then given me a brief picture of how OTs work, and then what are the opportunities over here in the UK to work as an OT. So that attracted me a lot. I mean, I thought like, oh, let me deep into the course again. And then I talked to one of Bangladeshi senior OT who was founder member of the OT in Bangladesh. And that gentleman, he has explained so nicely that how OT works. And he is such a good presenter, which also attracted me. Okay, I think that this might be the profession for me to work on and start on working on. I mean, to study on. Then I have kind of like get into the course, after getting into the course, it was really frustrating because nobody knows OT. If anyone asks me, oh, what are you doing? What is your study? What are you studying? I said OT, and nobody knows. I mean, some people, what it is. Then I need to explain. It's like physiotherapist, but not physiotherapist. So, then I had to explain them how it works, what it works. But as I did not have much experience, I could not say a lot about OT. Throughout having the experience working in OT, I am feeling a more deeper and deeper understanding about OTs and ways it works and how OT can work differently in different fields, in different areas, not only as a clinician, but also as a researcher, but also as a, in law and practice. Some OTs works for people rights and human rights and things. So there is huge opportunities for OTs to work. I mean, when I came to the UK, especially I think after I came to the UK, my understanding about OTs has increased a lot. I mean, I have started understanding how OTs do private practice over here in this country, how OTs do in different areas, work in different areas. Especially, I am on a rotational post, and I have started working from like general rehab and then wheelchair now, and then reablement and the areas. Now I work for major adaptation. I have also worked in acute hospital in A&E. So after having experience of working in different field, now I feel, oh my God, there is few other opportunities. I also work for sensory integration clinic, practice privately over here just for Saturday. But these areas of working in OT has given me a better understanding than an OT. If anyone wants to come into this profession, obviously financially they will not be loser. Additionally, if they have got something that they want to earn and as well as they want to do fun, they can do it. Okay, so earning, this is important. First thing is earning. Everyone wants to be financially independent and do their things. But it is a really easy way that people can get into a job. People can start earning money and then progress their career into different way. I also know another colleague who also privately practice, who is like reporting to the court. There are some private practice opportunities with working with the court, like with people with disabilities. And also he works for wheelchair practice, the private practice in wheelchair, sitting assessment. He is earning a lot of money, just sitting down at home, working 2 days in a week, and then writing down report rest of the days. People, if anyone wants to come in and enjoy their work, especially in health sector, I would advise, okay, yeah, come to OT profession. Obviously, definitely you will enjoy this sector. You can work.
Thank you, Mokter. You know, you kind of identified that there's so many different ways you can go with your career, and it's all dependent on you as the person, what you want to do. You know, there's the sort of like the hospital side of it, there's the community side of it, there is the, like you say, private practice side of it. And there's more and more occupational therapists setting up as private practitioners over here in the UK. I'm going to ask you guys in the US how it's set up in a moment, because I think it'd be good to hear that as well. But here, you know, there is a lot of scope to get into the human rights side of it, working with the refugees and campaign groups to help the populations. So there's opportunity in that. I mean, we keep saying our underpinning principles are around social justice and, you know, inclusion and the aspiration of all human beings to belong and to do. And to grow through that. So yeah, because we are working collaboratively with human beings, we know that there are so many different things that can come up and lots of different opportunities and pathways because of that human complex. Yeah, so yeah, that was really good to hear about those that have been very successful, and maybe they could tell us how they got so successful as well. But over in the US, you know, what is it like once you graduate, because the healthcare, you know, the health and social care system is so very different from the UK. What happens in respect to jobs?
For OT, it's actually very concentrated in certain areas. So it actually can be very difficult to find jobs in areas that are more concentrated. But then there's also areas where there's like not really many OT. So then those areas are also hard to find jobs in as well. But the market is there, it's open. There's definitely room for OTs to practice. I know more experienced OTs, they end up going into academia, which is more of a higher paying. A lot of people who want to work with adults, they go to skilled nursing facilities, acute rehab, subacute rehab, outpatient. There's a lot of opportunities here in the areas that are more concentrated. There's also opportunity to do private contracting with other companies. So you do home health. Home health is actually very common for pediatrics, for outpatients. Do home health, you visit and you do home health. You have also the opportunity to do part-time. So we say PRN, part-time. So you can be working with multiple companies at the same time and just do some work here and there. As a student, I think it really, in the US, I think it really, really depends where you are located. Location is kind of a key factor in that of how easy it is to find a job. And then another thing with pay is also, again, location. Different states pay differently. Different facilities also pay differently as well. But one of the more higher paying is like private practice, academia, skilled nursing facility, home health. If you have like a contract with a company, those areas are very, very concentrated. And then there's also school-based is very popular as well. A lot of schools have school-based OTs for children. So they come into the schools, they take the children out, they practice there too. And then there's also telehealth here. That's also practiced as well. I know in the pandemic, it's been more widely practiced, you know, as OT students. A lot of my classmates have been doing telehealth for their field works. So telehealth is a growing area for OT. I have a professor who does a lot of evidence-based research on telehealth, and that's like her niche, that's like her area of expertise, and she has a lot of experience with working in telehealth. In terms of as a new graduate, I think you do have to do a little bit of research, especially like where you want to work. You know, pediatrics is very concentrated. There's definitely a lot of competition in that area, I would say, from what I know. Adults, again, hospital settings are more common, and yeah, so those are the more areas. And OT is not that very diverse here. Approximately around 82% of OT practitioners. I say OT practitioners because we also have occupational therapy assistants as well. So they're certified, they go through schooling. So we have OTs and we have OTAs. So they work together. when giving service. The OTAs kind of like are under the supervision of actual OTs. So again, around 82% of OTs are white, identify as white. Around 6% are Asian, and around 2 to 3% I think are Black African American, and then less than I think 1% is mixed race and any other race or ethnicity, I would say, from the most recent data. So there's a lot of progress to be made in terms of diversity. In my school alone, I am maybe like one of 5 or 6 people of color in my actual class. So again, that diversity, that how do we get more students, not just Bangladeshi students, I think more people of color, more Black indigenous people of color, like that profession, the profession of OT, like in the US, it's been 100 years for OT since it's been founded. So there's a lot of growth and representation that needs to happen. And I know you're going to talk more about like how we get there as professions, because I read your question, so I'll answer that later.
Thank you. That was really helpful just to get an idea. And it is, I guess, the political, the educational, the regulatory, the culture that will drive how health and social care is conceptualized and what happens for occupational therapists within that. Definitely. There are popular specialisms here as well, the ones that are sexy for occupational therapy, if you like, like stroke and dementia and brain injury and wheelchairs and pediatrics, and there where people want to go to, and some different areas in mental health. And a growing one here as well is the criminal justice system, where we're getting more occupational therapists in there. I've got a few graduated students who've got into the career in the criminal justice system and really developing and forming how occupational therapy will develop in there and help those people, and looking at so many different aspects of the human being in relation to how occupational therapy can help. Yeah, that was really, really, it's got me thinking, Myrna, it's got me thinking. Thank you. So we're going to go on to our next question. Why do we need representation in the profession from people from the Bangladeshi communities? And what could be the barriers or blockages for people of Bangladeshi heritage to enter into the profession? Mokter, can I start with you?
Yeah, that's really good topic to discuss. I mean, it is. I would say that in our community, in Bangladeshi community, the awareness about health, the focus about health, their understanding about health is very limited. And the way they lead life, and it also, there is a lot of barrier. Okay. There are social issues, cultural issues. There are also familial issues. I mean, the way OTs work, I think you're talking about your dad and tablets and having problem and getting tablet. So, and also Myrna also was talking about something like this. So, I mean, I think we are still on the stage of thinking about having problem getting tablet. So we are not on the stage of thinking about, life is different, and explore it differently and think about the life differently. So our community doesn't have that, didn't go up to that level to think about life differently, okay? And they don't think about like social, psychological issues, social, cultural issues, and they don't think about the child development as well as adult and young's developmental things that OT can focus on a lot. Okay? So they just only focus on tablet and for their medical treatment and for their health treatment. Okay? So that is one of the main barrier for Bangladeshi communities. Okay? They feel like doctor is a noble profession. If anyone wants to get to the health profession, go to doctor's class. They want their children to be a doctor. Okay, because they don't think about something else. They feel like, okay, an OT come to visit home and do a toilet assessment. Oh, it's not a noble profession. It's something which can't. I don't want my children to go over there and do these things. And also children think, oh, okay, I would better practicing something else. I would better studying in I have got a colleague who studied in a different subject, general subject. And then she realized, oh, it is not good. She could have studied in OT. But initially she didn't think about it because there is barrier from the society, barrier from the community. That, oh, no, it is not an well-known profession. And what are you going to do? Toileting? Are you going to practicing toileting? Are you going to providing some equipment in the toilet? But if you think behind the scenery, someone is struggling on their life, and then you are boosting them up to be independent. So it will be only realized the person who was struggling, otherwise nobody would be able to realize what is happening throughout their life. So I think, I mean, this is what we would need to get our community, to tell our community, look, think about the life, think about the different aspects of our life. Don't think what you observe, think behind what is happening and how things can be changed more creatively, more efficiently. So then OT is the best profession, OT is the noble profession to help people's lives.
Thank you. Bijan, over to you.
Yeah, thank you. So that's a really good topic to discuss and to promote OT in our Bangladesh community, especially. Yeah. So whatever I want to mention first, so I can see within the Bangladeshi community is the very lack of awareness. They're not getting the information how OT does work and what OT can do with our community, isn't it? So especially for the Bangladeshi parents, I can tell always is the stereotype thinking, oh, my children will be doctor and engineering. But they always think the medical person is the physician, but they never think beyond the physician. There have other professionals that can contribute similarly to make life better, isn't it? They always think, no, physician, our children will be the physician. So the very, very lack of experiences, very, very lack of information, very, very lack of awareness. So we have to make them aware. So this is the OT. So that's why we need this broadcasting frequently so that we can reach up to our Bangladeshi community to make them aware. So this is the OT and what we can help with them. So lack of information is one of the barriers, I would say. So educate the parents, educate the individual, how OT can work for them. And number two, I would say is the expenses. So the OT course in the UK, if you consider the university degree compared to the others, is a huge expenses. Yeah, that's why the parents or individual, they might think, how I can manage this amount of money for the OT courses. So we have to consider this as well. So this could be one of the barriers. So expenses plus lack of awareness. So what we can do is to promote occupational therapy. So we have to do the awareness program so that we can reach up to the Bangladeshi people. That will help to choose OT as a career. And that will help for the parents as well to change their mind and think widely, just rather thinking tunnel vision. So no. So whatever Mokter told, so OT can work very widely, and that can help every single individual to improve their life, to improve their quality of life, isn't it? So end of the day, how qualityful life you're living, isn't it? That's the big question, isn't it? So I always tell, wherever doctor finished, OT start from there. For example, if you have given medication, doctor will discharge you. They will never thought of it, how you getting in and out of bath, how you having wash, isn't it? They will just provide the medication, that's it. But OT can work from the starting, wherever ending from the doctor, to help them how we can independently lead their life every day. So that's the importance as a professional. I think it's our responsibility as a professionals to make our every single individual within the Bangladeshi community so that they can think twice before choose the profession. So lastly, I would say, yeah, definitely OT, whatever they do, whatever I'm doing, definitely I'm loving it. Hopefully, once they will know this, OT, how does it work, OT, they can change their mind as well. So that's the thing. We have to closely work within the Bangladeshi community to make them aware. Yeah, that's really from me.
Thank you. I'm sort of making little notes as you're all speaking, so that I can summarize it. So there's some little golden nuggets coming through about this. So I'll summarize after we finish asking everybody. Yeasir, over to you.
Thank you. I'm absolutely agree with Mokter sir and Bijan sir that they mentioned that the current challenges to introduce this profession to the general population, even in Bangladesh, and people have still now the dilemma: is it a medical profession or not? So culturally, in Asian culture is very focused. People like white coat and they like to be a doctor, and this is the challenge. And they started occupational therapy career. Okay, I'm a doctor, and then they gradually realize that okay, it's the allied health profession. It's also a medical profession, but our thinking, our lens is not only in remediations. We have to think a lot of compensations and educations. So in that perspective, I like this idea. So already Bijan sir mentioned that we need lots of awareness program that we can promote to Bangladeshi community, and I can make it in two stages. The first is we need some intra-professional awareness, and then second one is inter-professional awareness. So intra-professional awareness, it would be we need more good examples. For example, here we are examples. So we're in abroad, we're doing occupational therapy, and we are Bangladeshi. So we need more people who actually can lead from the abroad, and people can see how we can change our life and how we can practice beyond our boundaries. So this is intra-professional, and you know that we are reading occupational therapy books since more decades in our country, and still now we are reading the examples, spoon, fork, and in Japanese culture they use chopsticks. So these are the examples. We use our right hand to eat, and to practice our eating we have to use our right hand. And here we need the explanation why you use our right hand, and how these manipulations by our hand is the part of our culture and it's part of our practice. So we need our evidence in occupational therapy. So we are the people who have to create evidence. So yet we don't have any Bangladeshi author in the books. We have a couple of occupational therapy books. So we have to take part there. So that's how we, oh, thank you. So, and inter-professional, that means we need more collaboration. In a country like Bangladesh, we don't have any interprofessional education course. So interprofessional education course can improve respect to each profession and can respect to each professional practices. So this education actually can make change and can advocate to each other to come more people to this profession. So these two key messages from my side.
Yeah, I had more than two there. Yes, sir, there were more than two messages in that little talk you gave. Yes, I am trying. I'm in the middle of writing a book at the moment with a collective of people around the world. So, yeah, hopefully we will get it together, and then you will have a Bangladeshi author of a book, and hopefully a core book it will turn out to be. Trying. Myrna, do you want to add something?
Yeah, in the US, I think it's also very difficult because OT is now transitioning from a master's now to a doctorate. So that's a higher degree. there's really no bachelor's degree now. It does not exist in occupational therapy. So even getting to college, the bachelor's degree, that in itself is pretty expensive in a lot of areas. And then for you to do the continuing education, go into a master's, go into a doctorate program. Eventually it is going to be a doctorate program in the US soon, in a couple of years. So that is another area of concern. It's definitely going to take a little bit longer. You're gonna have to have a bachelor's before you can even pursue, the degree of OT. So that's cost, that's time, that's a lot of consideration. So if you think about bachelor's here is 4 years, then doctorate programs typically usually 2 to 3 years. That's 7 years right there that you have to contribute in order to even get to the point of becoming an OT. Now, there are some universities that provide like the direct entry, like from high school to when you go apply for a bachelor's degree, you get the BS plus MS or BS plus OTD. Like you get the combination of getting a bachelor's and upper level degree at the same time in a shorter amount of time. But it's still, that's a lot of years to put in. There's cost involved. Not everybody is able to do that. And it's a full-time program. So you cannot even work in some cases. So there's expenses, there's loans, there's so many other factors to consider. And in terms of representation, again, like I said, what everybody else was talking about, I love how passionate everybody is about OT, how the representation, there's misunderstanding. So, the misunderstanding, like, why is the physician, the doctor considered more, superior than the nurse? Why is the physician the epitome of like the idea is like idolized, and here when we are taught a lot about interprofessional collaboration. What is the doctor without the nurse? If the doctor is giving the order and the nurse doesn't do it, so is that going through? What is the doctor without the radiologist who's doing the chest x-rays and stuff? That is all necessary. The doctors can't do their jobs without all these other health professionals that are helping them, that team, that collaboration that you need. And I think Bijan mentioned the doctor where they end, the OT starts. There's also another saying that I saw on social media. It's like, doctors add days to your life, but OTs add life to your days. So that people don't really think about, like, commonly, toileting you mentioned, somebody who suffered a TBI, who suffered a stroke, who suffered a spinal cord injury, to them, that's a whole process that takes us maybe 2 minutes. We're able-bodied 2 minutes, 3 minutes, but for someone else that takes 10 minutes, 15 minutes. People don't really consider those areas of life. Even in our Bangladeshi culture, you mentioned like eating with their hand. What does the person do when they cannot eat with their right hand anymore? There's the religious implication, there's the cultural implications that come with it. How does a person navigate if they are newly have a amputated limb? What do they do then? How do they use a prosthetic? So many considerations for those things. And I noticed those are not really thought about. If somebody's bedridden, they're bedridden. That's it. But there's more to it. That person has the opportunity to be more functional. They have the opportunity to do things more independently, but we don't think about this. The physician, they think, again, that magic solution. Physician is idolized because they are able to offer that magic solution that we want. They are giving us what we want. That's what they see that's what we see in doctors. But physical therapists and occupational therapists and speech therapists, they're making us work for what we want. People don't like to work for what they're expecting for their health. They want that solution, like, give me this, I'll be okay in one day. But you're making me work for my health. I don't like that. That is another thing that I noticed. People don't want to. I don't want to say people don't want to. It's just like putting in that effort. They're like, no, I don't want to do that. That's not me. I'm not going to do that. Oh, you're going to make me transfer. I don't want to transfer. I just want to get on the toilet. Like, that immediate solution. Again, that was another thing. Like, but for our profession, like, showing people, advocating like you're doing with BAMEOTUK UK. I just recently started as a student with my Instagram page, and I'm like trying really hard to not only talk about OT, but also talk about diversifying the profession. If we have people in our profession who look like us, who speak like us, who talk our language, you relate more with them. You're more inclined to see, oh, what is this person doing? Oh, they can explain this profession to me better. we have medical interpreters. Why? So we can understand our doctors better. We can understand healthcare professionals better. They can speak at the same level with us. But if you have someone who's telling you, you need to do this transfer, you need to do this exercise, why? You know, that you get that more empathetic relationship, that therapeutic rapport, that therapeutic relationship with your clients, with your patients. And I also, in the US, like I mentioned, the lack of diversity can throw off people. You know, they may feel like they don't belong in this profession. There's that imposter syndrome. You know, I feel that sometimes as well. When I went to go give my OT interview, I did not see anybody that looks like me. You know, I did not see, maybe like one or two people that are people of color. You know, I didn't see that. I'm like, what am I doing here? You know, that feeling that you don't belong in that profession, that feeling that you don't belong, that is also plays a role. But when you, in a lot of professions, you know, you have like, let's say you have a group of friends and 10 of them are pursuing a degree in medicine. They're all pursuing doctors. You're comfortable, you know, you have this group that you can rely on throughout school. You have mentorship, you know, you have people you can look up to in your community who understand your culture, who understand your values, everything. But then you go to OT school, who do you have to look up to? You don't have anybody for mentorship. You don't have anybody like, oh yeah, this person also went through OT school. Maybe I could ask them what it's like. They will understand my culture. They will understand my beliefs. They will understand my religious perspective. You don't really have that in OT school in the US from my experience. So those areas, those professions that are more concentrated, more South Asians in this area, more South people lean towards those areas because there's a sense of community, there's a sense of belonging and understanding. In OT, already it's not a known profession, and on top of that, you're telling me that I don't see anybody that's like me. Somebody like me is not pursuing that. Why should I go pursue that? That's where advocacy comes in. There's so many factors to it. There's a cost, there's a representation, there's the sense of belonging, there's the sense of culture. There's so many factors that I could go on and on about this, but yeah, that is my take on why we really, really need representation. And in my community right now, in my immediate community where I live, I'm the only person that's pursuing an occupational therapy degree right now. You know what, when people ask me, like, what are you studying? I can't even explain to them what I'm pursuing. And when I say, and then in their head, it's like therapy. Oh, therapy, so easy. That's that mentality that they come like, it's easy. You know, if it was easy, why am I pursuing a master's degree? You know, that doesn't click to them that this is a higher graduate level profession. You know, they're not just giving me the job. You know, they're not, I can't just become an occupational therapist. I'm not like just telling people to do a bunch of exercises or telling them to do certain things. It doesn't click. So that understanding is not there. There's a lot that has to be said and a lot that has to be taught.
Get on a podcast, Myrna. Get it all out on a podcast, a series of podcasts. And you'll be connecting with the community. You know, the themes that are coming up here are similar in the US and the UK, right? There's a thing about how are we getting in touch with our communities, you know? We know it's not working, then why aren't we changing how we're communicating occupational therapy, our presence, all those things? We probably need to change it because we're thinking in a very Western-centric way, and maybe we need to think like our community to get in there and understand them and understand how we're going to promote the profession. Also, the thing about visibility of people like us in the media doing occupational therapy. You usually see nurse or physiotherapists, but do you really see an occupational therapist? Although in the UK, we've had some popular soap dramas put in occupational therapy. So, you know, we're getting seen a little bit more in popular soap dramas. But it's those kind of things. Where do people go to see things or to get information? And should we try as a community of Bangladeshi occupational therapists to work in those ways to get ourselves more visible with our communities and to show that this is a profession in the medical profession, you know, that exists and that we exist within that. This idea of culture as well. One of the things, I guess, is becoming much more clearer to me and much more, in a way I feel pained by the realization of it, is that what is taught in occupational therapy is not culturally diverse. It's a very Western-centric, European-centric way of delivering therapy. And then once we graduate, we then try and make it culturally relevant. And that is my big push at the moment within occupational therapy as a profession, as a philosophy. It says it's built on inclusivity and social justice, but let's look at the literature. The literature doesn't say that to me. It says there's one perspective, and then from that one perspective, we have to then springboard and try and make it relevant to all the different cultures that we meet. So that's something, and it's a discussion that's happening a lot. I hear from the South African occupational therapists. They're having those bold discussions about it. Over in the UK, it's a nervous discussion. I'm trying not to make it a nervous discussion, but you know, I'm trying to say, well, it doesn't matter. Here we are, social justice, occupational therapy, and yet the way we deliver that education, the way we communicate the therapy is is from a global north perspective. And talking to an occupational therapist in Kenya, they're saying they're having that same thing, that all the literature, the students have graduated, the first lot have graduated, and now there's this mismatch between what they've learned at university and how to make it culturally fluid and relevant to the populations they work with. So that's something that you've kind of picked up there. And about authors and leaders, yeah, come on, hurry up, you guys, get on there, come and be the leaders, start writing stuff. You know, we do need representation, and we need to show our communities that this is the way, you know, this is the way to go. This is a career for you. There is, you know, success here. There is economic growth here. There is a widening of community and culture, you know. And I think we need to make that effort. The people who are already in it, we need to make the effort and not expect the people who are not in it to just get it, because they're not going to. We need to make the effort. That's very important. And then we will then chip away at those cultural barriers or, you know, inequalities, those differences that kind of stop us in a way from being diverse, from getting in those spaces that where we're supposed to be. Yeah. Yeah. So now I'm coming to my last question. You folks are so interesting. I wish I could carry on talking. But I know I've got to let you go. I've got to let you go. The last question, it's more about what would be your campaign punchline, your campaign slogan for occupational therapy and getting the Bangladeshi community interested in it as a career. So yeah, what would be your recruitment slogan? Yeah. Yeasir, would you like to answer that?
Thank you so much. So I wrote my slogan for promote occupational therapy all over the world. So the slogan is, let's create our prestigious occupational identity together.
And why did you choose those words?
So I have to explain. So occupational identity. So for example, the low and middle income country, people are struggling to having their identity after completing occupational therapy. So they're living their life in between dilemma where they're practicing at the medical or the social sectors. So like many occupational therapists, identity is like a developmental therapist. And also other occupational therapists, their identity, they seems like social worker. So have to be prestige, keep prestige in everyone's mind that we are occupational therapists. So it's in between all of us. So that's why I wrote this one as my slogan.
Thank you, thank you. Mokter, over to you.
Okay, I mean, there is a lot of things to say about OTs and to get people attracted to OT, but I would say that OT, come to OT, it will give you the understanding about life and the way to success.
Thank you, thank you. Prestige, occupational identity, the way to success. We could build something together in those words. Bijan, over to you.
So OT is the noble profession. So you can choose this profession. So this profession never let you down. So I can promise. Thank you.
Oh, yes. Novel and noble profession. I like the innovation and status. Yes. Myrna.
I don't have like a slogan, but if I were to talk to people about OT, I would say this is the only profession that really understands adding meaning and value to people's lives. It's one of the only professions that truly understands the significance of living our day-to-day lives. It's both science and art at the same time. And you really don't really think about your life as in the quality. It provides you the quality. It gives people the meaning, the ability to do the meaningful things that they need to do and what they value, what they believe. Those are what we do in our day-to-day lives. You know, we don't really consider our ability to do certain things like eating and being able to go to work and being able to dress ourselves and groom ourselves, like the things that are necessary to do as people and as humans in general. We don't think about those, and that's what OT does. They think about those things that we don't think about consciously, and OT is that profession that really makes you empathetic. There's a lot of room for you to understand a person, understand what it's like to live in different perspectives. You know, you get to learn about people's stories. You get to learn about people's experiences. You have that humanistic, holistic worldview that I feel like a lot of other professions don't get that opportunity to build that relationship, because we always talk about therapeutic relationship, therapeutic rapport, but how many professions really get to do that? We get to do that. We get to experience other people's lives. We get to experience other people's worlds. We get to take the opportunity to be empathetic towards other people, understand where they are in life, work on where they are in life, and what we can do to make that better for them.
Oh, that's a nice one to end on. Yes, I can see really, you know, and I'm hoping that this podcast will show to our Bangladeshi community that by increasing our presence in this profession, it will only bring good things, because it will bring more understanding, more cultural knowledge, more community. It will get us connected up with the health and social care systems as a community and infiltrate our cultural goodness into them. Because we are such a, you know, forget about the country's politics. As a people, we are such a resilient, peaceful and compassionate people. They need more of us in health and social care. They don't have many of us, and they need more of us, because we would change the climate of health and social care if there were more Bangladeshi people in it, especially in occupational therapy. So I just want to thank you, and I want to end with a quote I found by Rabindranath Tagore, and I think it really resonates with occupational therapy. And I'm just going to say it now. Everything comes to us that belongs to us if we create the capacity to receive it. And I think that's what occupational therapy helps people do, to open up their capacity, to open up their potential, to be able to do much more than they think they can do. So thank you very much, all of you. It's been a pleasure and I have enjoyed every moment of it. Like I said, I don't get to meet many Bangladeshi people, let alone occupational therapists. So this has been joyous for me this Saturday. Joyous. I can't tell you how wonderful it feels. Thank you very much.